Hello, I'm Dr. Rutledge, and I received an email from a patient who is a former patient of Dr. Himpens, and so I'm going to answer it. I won't give the patient's name, might give her or his initials, CT, and basically the patient says, I'm an MGB patient 2.5 years post-op. Her doctor was Dr. Himpens in Belgium, and she's very happy with her surgery and still at a low weight and doesn't give the details. Still active on a patient forum and was asking for my opinion. And rather than try and type it all out, because I'm an average typist, I thought I would respond to the request for information with this video. Her question is about reactive hypoglycemia. And talk on the boards among the duodenal switch fan crowd is that 40% of gastric bypass patients have more or less severe problems with hypoglycemia, and the duodenal switch patients don't. According to the email, the patient started looking for info on hypoglycemia. We got tired of feeling so very tired, often after a meal. Shortly after a meal, sometimes even during a meal, it got so bad I usually nodded off halfway through the meals. And I'd be in bed by 7 and then up again by 9. And this, as is described in the email, is a classic example of hypoglycemia or dumping after a gastric bypass. The problem with the vague feeling of tiredness is there's so many possible causes. Vague causes like just having not enough energy, etc. So we're going to talk a little bit about the general issue of energy, what to look about. Could be depression, things like that. And then I got fed up with overanalyzed, asked my GP, it was hypoglycemia. The doctor said, didn't think so. Later it was discussed on my patient board that the blood test does show an average blood glucose level, but not the amount of fluctuations it did. Anyway, I proposed that I would buy a blood glucose meter myself and monitor her blood. She shrugged, okay, I monitored myself, not at various times after eating, but at various levels of tiredness, mostly because I eat dinner at different times in a 3-hour period. Depending on when I got home and how much time preparing dinner I took, and what point at a meal I nodded off. There was some correlation with tiredness, but a more clear result was that my blood sugar level did fluctuate between really low, 2, and 11. So, according to this, I've diagnosed myself with hypoglycemia. The advice of what to do is simple. It's outlined here in many places. In short, eat often, little and balanced when blood sugar low and eat, and keep blood glucose monitor to track. What do you think of my story? And here's her questions. Is it true that blood glucose test isn't reliable for MGB patients? The answer to that is no. Is this a non-healthy hypoglycemia? And we're going to come back and talk about that a little bit. Is it unhealthy? Any research on how common it is? And so we'll talk a little bit about that. Could that hypoglycemia be the same reaction I've always had even before surgery? Answer to that is yes, and we'll talk about that. And it would be good to warn patients to look out for these symptoms, and yes, so that's why this video will be placed in the public domain for people to look about it, and then other questions. So, thank you for that good question, and let's talk about it a little bit. So, the hypoglycemia, which is a name some people are using now, basically it's kind of dumping, and dumping can happen in anyone with a burst of sugar placed in the bloodstream, followed by an overreaction of insulin. And the way that works is kind of worth talking about for a minute, and that is that when we eat, the body digests and absorbs starches and converts the starches to sugar, to small molecules of sugar. And if it eats certain kinds of disaccharides like sucrose and lactose, those are broken up, and the individual glucose molecules or dextrose molecules are absorbed. And when they're absorbed, those sugar molecules in the bloodstream can cause a problem if they're too high. And so the pancreas monitors the amount of sugar that's coming into the bloodstream, and in a perfect world releases the precise amount of insulin necessary so that the blood sugar can be controlled. Now, whether or not you have a mini-gastric bypass or a Roux-en-Y gastric bypass, or even if you have a sleeve or a band, you can get what's called type 2 dumping, where you have a burst of blood sugar, where the blood sugar levels go up, and then following that, the release of insulin is mismatched, so that there's either too much or too little. So we're going to talk a little bit today about the too much reaction. So what happens in that case is pretty straightforward. The body should perfectly match the amount of sugar coming in with the amount of insulin released, and if it doesn't, then you can have trouble. The trouble we're talking about today is where the estimate by the pancreas of how much sugar to release is a mismatch. There's too much insulin. When that happens, then the blood sugar goes low. Okay, now so there are a couple of things. If you were without a gastric bypass and just to have a very sugary meal, and so an example might be a soda pop with a lot of sugar in it, a candy bar, something like that, oftentimes people, even without bypasses, will have trouble with intermittent hypoglycemia or tiredness in the afternoon. And so this is something you want to be careful of, and as you point out in the email, you want to go ahead and choose to eat foods that are less likely to give you a burst of sugar. Okay, so let's think about that for a second. Soda pop, ice cream, candy bars, things like that can be associated with a burst of sugar because they contain a lot of sugar. So what you'd like is something that has a lower, what's called glycemic index. So, for example, a bagel has a pretty high glycemic index, and we might also get into talking about glycemic index versus glycemic load and things like that. But for now, most people understand a glycemic index a little bit more, so we'll talk about that. But anyways, something with a high glycemic index puts a lot of sugar into the bloodstream quickly, and so therefore there's a greater chance that there'll be a mismatch in the eating of a bagel or a soda pop than with eating of foods which have a lower glycemic index. So for example, you can convert a high glycemic index bagel into a lower glycemic index meal by adding a little bit of butter or cream cheese. So interestingly, oftentimes there's very little that needs to be done to modify that burst of sugar. You want to delay the rapid absorption of sugar so that you don't have a high spike in sugar, and then that can cause the pancreas to overreact. And so there are a variety of foods that you can think of that work better to avoid this drop in sugar after an intake of a high sugar meal. So for example, let's think of a couple of things. You could eat a soda pop, you could drink a soda pop, you could eat a cookie, you could eat cake, candy bars. These are classic examples of high sugary foods. Other things though, sometimes you can do it is mashed potatoes, because that starch can sometimes be digested quickly. And again, what you might do if you're having mashed potatoes, you might be able to change that into a slower digested starch by adding butter. Or maybe better, healthier, is to choose olive oil or something like that, or to mix a bite of mashed potatoes with a bite of broccoli or a bite of something healthy, maybe a little bit of fish or lean meat or something else, so that you delay the burst of sugar that comes with that meal. Now, as we say, then anyone can get this hypoglycemia or type 2 dumping. It's certainly more easy to get this type of reaction if you have a bypass, because there's no delay in the food moving from the stomach, because the stomach is either a small pouch with the gastric bypass or just an extension of the esophagus in the mini-gastric bypass. It's just a long tube. When that happens, that means that the food gets dumped immediately into the small bowel. So what this means then is you have to be cautious about what you eat. And in fact, this is going to work to your benefit if you pay attention. Obviously, you don't want to feel bad. You don't want to feel sleepy. That's a bad feeling, and it's a warning that what you ate prior to this was incorrect. And you might say, well, I'm angry, or I'm disappointed, or I don't like that. But what it's saying is you've had a sugary, starchy meal, and you can fix that by just changing what you eat. And there's a variety of things on that. Eat smaller amounts, eat more slowly. Eat foods that have a lower glycemic index, and I won't go into that. But basically, the MGB is designed as a contract between you and your doctor and the surgery. And the contract says, I do not want to be fat. And so in the event that you eat a bunch of sugar, there's going to be problems. You can't do it. If you try and do it, the MGB will rebel. The MGB will, in a way, punish you. It will stop you. It will intervene. And so that our patients cannot beat the MGB by eating sugary, sweets, and starchy foods. Now, let's stop for a second and say if you have a lap band or a sleeve, it's easy to beat the surgery. Okay? If you have a band, it's easy to overcome the restriction. Just drink a Coca-Cola. Coca-Cola is an easy method to get 800 calories in by just drinking a 2-liter bottle of Coke. You can easily get 2, 3, 4,000 calories a day through a lap band by just eating the wrong foods. And this is not because a patient is a bad patient, it's because the drive to eat is very powerful and very primitive. And so a lap band or a sleeve patient oftentimes will fail because the restrictive capability of the surgery interferes with eating healthy foods like broccoli or salad or an apple or a banana, whereas junk foods or bad sugary foods go down very well. So what we want to tell you though is the MGB is designed to interfere with, quote, beating the surgery. You cannot get around the MGB by drinking sweet, sugary type calories, by eating candy bars, because you'll be struck by the interference with dumping. And in fact, we like that. It's a preventative measure. If you try and do that, we'll put you to sleep. It's designed to work that way because we want to intervene and prevent you from eating a lot of sugar. And if you've done that, if you make that mistake though, there are recovery methods, but basically this is an educational tool. Stop eating sweets, stop eating fast, stop eating high glycemic index foods, and generally our patients with MGB will not have trouble with hypoglycemia. Now there are cases where the hypoglycemia becomes intractable. It's just impossible to deal with. Remember that bypass can cause stimulation of the beta cells in the pancreas so that we can actually see cures of type 2 diabetes after a mini-gastric bypass. And in some cases, although rare, that growth of the beta cells which make insulin in the pancreas could be so overwhelming that you might need to do something else like revise the surgery. We've not ever had a case like that. Certainly it makes sense that it could happen. With 15 years follow-up, we haven't had anybody who has intractable hypoglycemia. But it certainly makes sense it's a possibility. If that happens, one of the nice things about the MGB is it's so easy to revise. So keep in mind, if you're ever just disappointed or angry or upset, you don't like the MGB, you don't like the being forced to eat a healthier diet to avoid sugary, starchy foods, that you can always undo the MGB. And laparoscopically, that's a 20 to 30 minute surgery, and we have other videos on the internet so you could see just how that's done. But we have not had to do that. In general, what you need is some advice. You need to eat regularly, generally in the morning, don't skip a meal. Generally eat healthy foods, so fresh fruits and vegetables are good choices. Sweet juices, sugary drinks, those kind of things are bad ideas. And usually that's really easy. If you look, we can go in another time and go into more detail about the food you eat. But basically hypoglycemia after MGB is like the hypoglycemia or the dumping syndrome that can occur in anyone. It occurs more frequently and you are more sensitive to it because of the bypass, and that's designed to be a block. It's designed to be a signal. It's designed to be a roadblock so that you cannot eat your way out of an MGB. The MGB is very effective over the long term and protects you against regaining weight because high intake of sugar will cause type 2 dumping. And you don't want that, obviously, so protect against that. Now let's say that you make a mistake, that you're out at a party, you made a mistake, you drink too much sugary foods, and you get hypoglycemia. We recommend you treat that. And it's easy to treat that by just keeping a couple of packets of sugar in your purse or in your pocket or in your car. And you can have just a little bit of sugar to kind of perk yourself up so you can feel better to get through the hypoglycemia, and then begin looking around for some other types of small amounts of food that you can take in which have a longer digestive process, that is a lower glycemic index. And that can kind of get you out of trouble, quote unquote, with hypoglycemia very easily and very quickly. There are other more high-tech ways to do it. You can get some things for triathletes where they have kind of sugar packets. Jelly beans work. All kinds of different things are reasonable things to keep available in the event that you make a mistake. You have some high glycemic index foods, you get a little bit sleepy, you've had a little drop in blood sugar, and so it's easy to fix or repair this situation. So don't hesitate to go ahead and choose to manage that if you need to. But then remember that whatever you did that time, you should avoid doing the next time. So if you notice that you were drinking coffee, with caffeine, which can sometimes stimulate the release of sugar and can cause a dumping syndrome. If you're having soda pop, if you're having candy, if you're eating cookies or cake or mashed potatoes, whatever it is, pay attention, because that's your body telling you that that's not a good food to eat, or that you ate it in the wrong way. That is, too quickly, too much at one time, something like that. So that's type 2 dumping. Usually easily fixed. Pay attention, eat more frequent small meals. There's lots of resources on how to avoid it and how to manage it, but it's something very simple. Sometimes, though, you can have these same kind of symptoms of tiredness and sleepiness, and it's not hypoglycemia, and that can be a confusion a lot of our patients are unaware of. And I'd like to talk about that because many of our patients are not hypoglycemic. That is, they have normal blood sugars, but they're still sleepy and tired, and what we found here is it's dehydration. The MGB causes a profound weight loss, and it changes the hormones in the body that retain salt and water. So a patient's blood pressure goes down, peripheral edema, that is swelling in the ankles, goes away. And with this diuresis, that is the loss of fluid in the urine through the kidneys, oftentimes we find patients can have periods of tiredness and sleepiness and weakness and things like that. It's not hypoglycemia, it's simply not paying attention to keeping in an adequate diet during the day. And again, just like paying attention to what you eat, paying attention to salt intake is very important, we have found, after mini-gastric bypass. Lots of patients don't pay attention to this. They think they're eating normally. They might skip breakfast or skip the time between breakfast and lunch. And what we've found is with the diuresis, with the change in the salt-retaining hormones, that can lead to weakness, tiredness, sleepiness, lack of energy. And really all it is paying attention to the timing of what you eat, and particularly adding more sodium into the diet. Now, for everyone else in the world, adding sodium into the diet is a bad idea. We all have tons of sodium as average people with average gut. And so, in fact, sodium makes foods more tasty. So the manufacturers of processed foods and people who just eat food with salt on the table find that adding salt adds tremendously to the taste of food, so that many people are taking in much too much sodium. That's not the case for mini-gastric bypass. That's not the case for mini-gastric bypass. For mini-gastric bypass, you need to have more salt. And a good way to test this is just to stand up quickly. So if you're finding you're kind of weak and tired, you stand up quickly, and you particularly notice that you have a worsening of those symptoms. You're more tired, you're more sleepy, you're dizzy or something like that. That's a good rough and tumble way to see that you have dehydration. And the treatment for that is simple. Again, it's a little bit of salt and water. Salt water by itself is not that tasty, but Gatorade works very well in the United States. Another thing you can do is, in addition to those sugar packets in your backup kit in your purse or your glove compartment, you can have a couple of salt packets. And so some salt along with some fluid, occasionally with a tiny bit of sugar in it, can kind of give you a nice burst of energy. Beware of taking too much salt like that, but you can, as I say, use it as an emergency recovery. But too much sodium taken that way can be dangerous, so make sure you talk with your doctor before you consider that. But for mini-gastric bypass patients, we found that a little burst of salt can help if you're feeling weak and tired. And other things, you don't actually have to take salt, but you can eat things that have salt, like pretzels, potato chips. Potato chips can sometimes not be the best choice because of the fat content. But salty foods like that that you would find in most places seems to work quite well in addition to some liquid water or other kind of fluids to help restore your feelings of energy and strength during the day. And that's especially true when we find the mid-afternoon slows, the after-dinner slows, things like that. So pay attention to that, and if you would, contact me. I can give you some more tips and information on these issues. There's another question, I think, there where they ask about should you have a blood glucose monitor. And certainly if these kind of things are more than just slightly bothersome, we think a glucose monitor is not a bad idea. In most cases, our patients do extremely well health-wise. Oftentimes these kind of symptoms can be confusing to your local doctor, so oftentimes it is helpful to contact your surgeon and discuss these things and get some extra tips or pointers on this. We've also had the misdiagnosis of ischemia, stroke, and heart attack and heart disease based on these simple symptoms, and so oftentimes a contact with your surgeon can help get these things straightened out for you and your local doctor. So there's a little short video on those topics. Please don't hesitate to email me and ask other questions. I'll be happy to try and help. And this is Dr. Rutledge. Thanks very much.